I want to talk about depression. My name is Sam, I'm 35, and this is not how I thought my life would turn out. I received my first formal diagnosis of depression in 2014, but looking back, I've been dealing with this illness since childhood. Some of my earliest memories are permanently linked in my mind with depression, fear, pain, and anger. But I'm getting ahead of myself. Depression is described in the dictionary as a mental state characterised by a pessimistic sense of inadequacy and a despondent lack of activity. First documented as far back as ancient Greece, where it was believed to be caused by an imbalance of the four bodily fluids known as humours, and was named melancholia from the ancient Greek melias meaning black and chole meaning bile. Hippocrates described it as its own distinct illness, and Aristeas of Cappadocia would later observe that sufferers would be dull or stern, dejected or unreasonably torpid without any manifest cause. Depression is one of the most well-known mental illnesses on the planet, with the 17th century scholar Robert Burton suggesting cures from implementing a healthy diet, sufficient sleep, music and meaningful work, along with talking about the problem with a friend in his book titled The Anatomy of Melancholy. But, like everything important in my life, I have been obsessing and hyper-focusing on depression for years now, comparing my own experience to that of generations past in an attempt to understand why I suffer from it and why it affects me in the way that it does. There is no one universally recognised cause of depression. Even now, over 2,300 years after it was first recognised by Hippocrates, we still have no definitive cause that we can attest to the illness. That said, there are a few causes that are widely recognised. Stressful events are a common trigger, a relationship breaking down or the loss of a loved one for example. Complex and difficult emotions surrounding these sort of life-altering events can cause depression as an individual attempts to navigate them going forward. Hormonal changes are a known cause of depression. These are well documented during pregnancy and after giving birth, as are the changes to hormone levels during the menopause. Hypothyroidism is also a common cause of depression, as the lack of hormones produced by this physical illness has strong links to depression and depressive symptoms. Some people have a genetic disposition towards depression, with some studies showing that you are 50% more likely to have depression if someone in your immediate family has it too. Depressant substances like alcohol and cannabis can be linked to depression as a cause, as well as a common way of self-medicating from the effects of the disease. Long-standing illnesses can also trigger depression, as can long-term pain. One of the more recent discoveries has found a correlation with head injuries and depression. While head injuries and mood changes have long been studied, with the most famous case being that of Phineas Gage taking a metal bar through the brain in 1848, resulting in total personality change for the remaining 12 years of his life, the link between head injuries such as concussions and depression is a relatively recent discovery. So it's safe to say that the majority of depression cases can be put under the blanket of trauma. Now wait a minute, I can hear you cry. I've heard depression can be caused by chemical imbalances in the brain. What about that? Well, that's sort of true. While modern antidepressants work by altering the way the body produces and reabsorbs chemicals like serotonin, there is little evidence that changes in brain chemistry cause depression in the first place. The reason for this is simple. It's because the research into it is currently kind of lacking. Bluntly put, we are yet to understand the complexities of brain chemistry well enough to definitively say that changes in said chemistry can cause depression. But going back to trauma, that's very well documented, and anecdotally, I can attest to it too. My earliest memory is of me as a very young child being in pain at my local hospital after a surgery I had. I wouldn't have been any older than 3 at the time, but I can still see the wallpaper in the children's ward vividly. I can feel the sharp pain radiating from the surgical site, and I can hear myself crying in pain. That's the first thing that I remember. Pain. Trauma. My next oldest memory is meeting my first best friend in primary school. I remember jumping towards him off a log in a play area and him dodging me. I went head first into the log he was stood on. I remember the pain in the top of my head and my neck. I remember him picking me up and checking on me. I would have been about 5 or 6 years old. I remember being 11 years old and getting my first formal concussion diagnosis. I'd hit the back of my head on the coping of my local skate ramp and had been taken to hospital where I was checked over. Why is that significant? Well, it was from that point onwards, looking back, that I first started experiencing what I now know are symptoms of a major depression disorder. From my second year of high school onwards, I've been dealing with dark thoughts and depression, and I've tried a multitude of fixes. Depression has had some frankly horrifying attempts at cures tried out over the years. From prayer to electroconvulsive therapy, humans have tried some frankly mad things to fix a person's depressive feelings. The now classic meme, "you've got ghosts in your blood, you should do cocaine about it," can be used to sum up many early attempts at curing mental illness. From the benign to the horrific, doctors have tried all sorts of pills, potions and procedures to try and fix the issue. In my obsessive nitpicking through the history of depression, I gained a real appreciation appreciation for living in the current era, because with my symptoms and lack of modern treatments, I could well have been a victim of some of the more horrid cures that have been attempted. One such treatment I would have been facing would have been the infamous frontal lobotomy. Originally developed by Portuguese neurologist Antonio Egas Moniz, the lobotomy or lobotomy was a surgery to separate the prefrontal cortex from the rest of the brain in an attempt to cure psychological condition. His work in the mid-1930s paved the way for the most famous version of the procedure developed by Walter Freeman, officially known as the transorbital lobotomy and colloquially known as the ice pick lobotomy. Why such a vivid name? Because Freeman literally used an ice pick from his kitchen to perform the procedure. Touted as a cure to violent psychological conditions, seizure disorders, and extreme cases of depression and associated conditions, the procedure was little more than an inaccurate way of delivering targeted brain damage. The result of the lobotomy was patients who were calmer, docile, and easier to control, which is unsurprising given they were essentially just stabbed in the brain and had a large metal spike wiggled around tearing through their frontal lobe that controlled all of their emotions. The surgery would often lead to infection, loss of bodily function control, and death. It was disproportionately used on women who were deemed hysterical and gay men due to their sexual orientation. The USA would have an estimated 40,000 lobotomies performed. The UK would add an extra 17,000 to this number, with multiple Scandinavian countries adding a further 9,300 to the estimated worldwide figure. I say estimated here, as accurate numbers were never recorded due to the stigmatization of mental illness in the 1900s, and officially speaking, the surgery has never been outlawed in the US despite most Western countries banning it in the 1970s. Amazingly, even the Soviet Union had banned this procedure by the 1950s, showing just how stigmatized anyone deemed abnormal were during this era in the Western world. Lobotomies weren't the only extreme measure taken in the pursuit of curative measures. The concept of sanatoriums and asylums for the mentally ill was the first step of many in the treatment of mental illness. Often conceived and marketed as grand hospitals, most turned into prisons, locking the mentally ill away from society. Conditions were more often than not deplorable. Stories of patients assaulting each other, staff abusing and assaulting patients, lobotomies, insulin shock therapies, electroconvulsive treatments, forced and heavy sedation, vaccine experimentation, removal of body parts such as teeth and the appendix to prevent future infections, even if they were healthy or in good condition, injection of malaria and injection of camphor were all reported over the years. The use of restraints such as straitjackets and the infamous padded rooms were commonplace. The horror movie depiction of asylums in film is sadly not that far removed from the truth. I'm very aware that if I was born as little as 50 years sooner than I was, I would likely have been locked away from the public permanently. But I wasn't, so now I receive treatment which is much better research and controlled than decades past. Now, everything from this point onwards is based off my personal experience with mental illness. I'm not a medical professional, nor do I pretend to be one. What I say going forward is purely from my point of view, and I'm going to be very candid about my experiences. I don't have anything to be ashamed of about what I've lived through, but I also won't hide anything either. So if blunt, to the point talk about very dark subject matter is something that you're sensitive to, or if you know me in real life and don't want to hear what went in my darker thoughts and days, I suggest you stop watching. Currently, I take a serotonin and noradrenaline reuptake inhibitor, a tetraacrylic antidepressant, and a beta blocker for my depression and anxiety. They work pretty well, but they're not the first medications I've tried. In the years following my diagnosis, I was prescribed 3 very common selective serotonin reuptake inhibitors. The first 2 of these did very little to improve my condition. The third made me have very strong thoughts of causing harm to those close to me, so I quit that one cold turkey, which is stupid and dangerous, but at the time I felt it was better than the alternative. I've also been on a mood stabilizer from when I was an inpatient at a psychiatric hospital. It was extremely dangerous. I was monitored weekly with blood tests and saw a doctor every 3 days for assessments. I was on the highest prescribable dose allowed in the UK, and in my opinion, it did fuck all to help me. The doctors obviously agreed with my assessment, as I was weaned off it within a year of it being prescribed, as it did nothing to help me. Along with this chemical assistance, I've undergone multiple types of therapy, including cognitive behavioural therapy, which didn't help, art therapy, which didn't help, mindfulness training, which helped quite a bit, group therapy, which actively set me back in my recovery, and one-on-one talk therapy, which helped a little bit. I've had care in the community come out to assist me returning to both home and work, which were huge helps, and I've had a lot of help from occupational therapists in dealing with returning to a somewhat normal day-to-day. But that's only since my diagnosis. What about before 2014? Well, I had 2 main outlets. alcohol, and self-harm. From around the age of 16 I drank. At first it was just a rebellion thing, but eventually it became a real crutch. I've had two peaks when it comes to drinking. One was at university and the other was just before I was hospitalised. At university I used alcohol to overcome my anxiety. My logic was if I was drunk all the time I wouldn't care about not fitting in. I was just the guy who partied a lot. So I drank. A lot. All of the time. At my worst I was drinking from the moment I got up to the moment I passed out at night. I drank on my way to lectures, sometimes even during lectures. I'd stop off at my local on the way home for a drink and then drink at home, and then I'd go out at night. I had a different bar for every night of the week, and most of the staff knew me well enough that I didn't even have to order. They'd have my drink ready by the time I got to the front of the queue. A typical Thursday, for example, was I'd get up and I'd have a beer. I'd walk to university and stop for a pint at the local. I'd sit through lectures, then go to the student union for lunch and have another pint. I'd do my afternoon practical sessions. I'd walk home, stopping at the shops to buy my pre-gaming drinks, as well as stopping at the local again for another pint. Get home, have a beer while working on a project, cook and eat my dinner, drink an entire bottle of wine, and then share a bottle of off-brand shots with my housemate, and then we'd actually go out and start drinking for the night. We'd leave the house around 8 or 9 p.m-ish and wouldn't get home until 3 or 4 a.m. While out, I'd be drinking double whiskey and cokes, beers, or shots, often all at the same time. There was a period of time at university where I forgot what it was like to not be hungover every morning. I literally forgot you could wake up without a headache and nausea. I struggled to feel normal at university. My first year it was homesickness, second year it was feeling socially outcast compared to other people, and in my third year it was the stress of producing a short film almost single-handedly, as I didn't have a group to work on my project idea with, so I decided to solo it. I drank to numb the pain of feeling alone, and despite making some friends, I never fully settled during that time of my life. The drinking became my way of coping with this, and the self-harm was prevalent too. In my first year I got to the point that I tried to end my life. I got lucky and I failed, but this wasn't my first time. My first attempt was when I was around 12, my second was 15, my third was the attempt in my first year of university, and I've had 2 more serious attempts and several close calls since then too. I've tried different methods, and obviously they've all failed or I wouldn't be here to tell the tale. This is my first time publicly admitting to attempting suicide. Fortunately, I'm apparently very bad at it. My second peak of drinking was in 2018. I was dealing with issues in my personal life, and the only thing that stopped me from remembering those things and hurting was alcohol. So I drank, and not even the good quality stuff either. The cheapest and highest proof whiskey I could get was my go-to. Before I went to hospital, I was downing a bottle a night on average. I was self-harming again too. I was having to hide anything sharp in work to stop myself from using it on myself when I was hitting my lows, but at home that was a lot harder. I was isolating myself as much as I could without drawing too much attention to it as possible. Then one day it all came to a head. I walked out of work, got in my car, drove to the highest bridge in the area, opened the bonnet of my car to disguise what was really happening, and went and stood on the barrier of the bridge looking down at the floor below me. I have no idea how long I was there for, I have no idea what stopped me from climbing over the railing, but eventually I closed the bonnet of my car, got in it, and drove home. I'm not saying any of this to romanticize my life or suicide. I'm not saying it for sympathy, this is simply what I experienced. I was admitted to hospital the day after the day I stood on that bridge, and was an inpatient for around 4 months. I have very little memory of the first month I was in hospital for. I started at the Ablett unit at Glenclwyd and was transferred by my request to Wrexham a few days later. I had support from family, friends and the care teams that got me through it, but one thing I don't want to underplay is how big of a difference music and writing made to my recovery. I played and listened to a lot of music in hospital, some heavy, some not. It was my go-to thing. I put headphones on and just listened to music constantly to interrupt thoughts inside my head. My dad brought me in a guitar and I played daily, something I hadn't done since I was a teenager. I also wrote lots, journaling everything I could, page after page. It was my obsession. My journey with depression has been lifelong and likely won't stop. I've come to accept that I'll always have to deal with being depressed, so I've taken active steps to try and make things as livable as I can. This channel, for example, is a way of me making longer form content to scratch the creative itch and give me an outlet through writing and editing. I build and ride motorcycles because being on 2 wheels is better than any therapy I've ever been to. I practice mindfulness techniques, I watch comedy creators, I take photographs, but the depression is always there. And until you've experienced that firsthand, you can't really know what it's like. It's not the movie stereotype of crying in the shower or smashing glasses against the wall. In reality, it's an hour of internal arguments with yourself to get out of bed in the morning. It's the fighting your way up a flight of stairs just to get in the shower. It's the constant self-checking and active work process to get yourself through to the next day. Depression fluctuates. Some days you'll be fine. Other days you'll have to battle yourself and your thoughts a minute at a time, getting through these 60 seconds to get to the next 60 seconds, to get to the next 60 seconds until the day is done. It can be absolutely exhausting, and the statistics sadly show this. Recent estimates state that between 5 and 10% of people have or have had depression. That's 280 million people worldwide. It's an illness that doesn't care about your race or socioeconomic background or what country you're from, but it does seem to affect the different genders differently. More women than men are reported to have depression, with around 60% of reported cases being from women. That said, the way that women handle depression seems to result in better outcomes than men. Women respond better to therapies and treatments than men do. Sadly, men have a much higher suicide risk when dealing with depression, with them being 3 to 4 times as likely than women to take their own lives. It's believed that for every one suicide death, there are 20 attempts made, and it's the biggest killer of men under the age of 50. In the UK alone, 12 men a day die by suicide. As someone who deals with suicidal ideation and having attempted it in the past, I understand the appeal. The thought of not having to deal with anything anymore is a difficult one to overcome. Depression doesn't discriminate when it comes to suicide either. It's claimed prince and pauper alike. Fame and riches don't ward off the thoughts, as can be seen in so many celebrities taking their own lives. There are stereotypes surrounding it for a reason. The tortured artists like Kurt Cobain, Sylvia Plath, Robin Williams, Hunter S. Thompson, Ernest Hemingway and Chester Bennington are as infamous for their deaths as they are for their work. Unfortunately, the old adage of suicide being a permanent solution to a temporary problem doesn't ring true for many sufferers of depression. The knowledge that we have this illness for the rest of our lives is a heavy burden to chronic sufferers. Knowing that I face a lifetime of medication, low moods, cyclical negative thought processes and associated side effects makes the prospect of finding a permanent solution pretty damn appealing. But there is a light at the end of the tunnel. New breakthroughs in the treatment of depression disorders are occurring more and more. Experimental treatments such as the microdosing of ketamine has shown positive results in the permanent treatment of depression, as has the non-invasive use of high doses of magnetic brain stimulation. Psychoactive drugs such as LSD have had some long-term successes at treating depression as well. Having lived with depression for most of my life, if I was offered these sort of treatments in a safe and controlled setting, I would definitely try them, because I've tried damn near everything else. I've been pumped full of SSRIs and SNRIs, I've had my heart rate controlled by beta blockers to try and calm my anxiety. I've been loaded up to the eyeballs with lithium with no appreciable effect. I've been sedated with doses of lorazepam and sat through insufferable motivational group therapy sessions that have made me more depressed than when I started. But I'm still here, and I'm still vocal about my mental health struggles, because the one thing that the mentally ill community is quite good at, from my personal experience at least, is looking out for each other. Be it through a song, a coffee shop meetup, a takeaway delivery, a box of tissues, or a simple message saying, hey, how's things going? We look after each other. I have friends who struggle with depression who have been there for me when I needed it and who I'm there for if they need me. I'm very comfortable talking about my mental illness because, frankly, I don't give a shit what people think about me. I have enough to deal with inside my own head to spend time on the opinions of others. Sure, I enjoy the companionship of friends and family, but outside this small circle of people, I don't really care what people think of me. I do what I have to do today to keep me alive for tomorrow, but I'm also aware that I'm kind of in the minority of people in this. The vast majority of sufferers are trapped feeling like they're alone and feel they'd be shunned or abandoned if they openly acknowledge their illness. And sometimes this is founded in reality, with many people losing friends and loved ones due to the perception of people with mental illness, and others having their illness used as a weapon against them. Depression is a very real, physically draining condition, and the sooner we all stop stigmatizing it, the better we all will be.
Nothing, I'm fine, I don't need therapy, I'm good.